Danielle Teal, your moderator for Our Town, the show about Rochester with a brand new segment called Our Spotlight for KSMQ Public Television. We'd like to thank 125 Live for hosting. They're incredible and amazing, and they bring all of our key players together so we could do such an amazing show. The topic for today is first responders in the midst of COVID-19 pandemic. And I am honored and humbled to have our first responders on this show today. Thank you so much to you all for being here right now.
Thanks for having us.
Thanks for having us.
Thank you. I look forward to connecting with you, and especially thank you for your service. If you could go ahead, Jeff, we'll have you start off and we'll go around, introduce yourself, what's your name and role, and what do you do?
My name's Captain Jeff Stillwell. I'm responsible for the community services team, and I have been responsible for the patrol team, the first line response for most of the COVID since we went into the COVID crisis.
Okay, Kate, you can jump right in.
My name's Kate Arms. I'm the operations supervisor for Mayo Clinic Ambulance here in Rochester.
And then Mandee, go ahead.
My name is Mandee Marx, and I'm a firefighter with the Rochester Fire Department.
Well, we're so glad to have all three of you here today. We'll go ahead and jump right into what everybody is talking about. It seems like we can't avoid it on our social media, in the news, you name it. COVID-19 continues to spread across the nation, and the states around us are showing an increase in COVID cases. Squeezing Minnesota, it literally feels like all those states around us are squeezing us with COVID happening in their area. What do you believe we have done correctly? And what do you recommend folks should do to help mitigate the spread? Mandee, do you want to jump right in?
I believe that we wearing masks has helped, I'm sure, and just washing your hands and just socially distancing when we can. It's probably the best thing that we could do to try to avoid the spread. So yeah, that's basically just wash your hands, wear your mask, and do those kind of things.
Mandee, just to add more to that, what is the fire department's role in this in relation to COVID-19?
We're still responding to all medical calls and any type of other 911 emergency responses that we go to. And I think we wear our PPE, we wear our mask, we wear our gloves, we wear goggles now as part of our PPE, and we respond with like Gold Cross or with the Mayo Clinic Ambulance, and also with fire or with police to all 911 emergencies. We just take extra precautions to make sure we don't get it and spread it to other people too.
Mm-hmm. And I'm sure you all know each other, is that correct?
Yes.
Yes.
Jeff, go ahead and add your perspective to this. What do you think we've done correctly in Minnesota?
So I think I tend to agree. I think masks and being cognizant of hand washing are great. I think citywide and with the whole team here, we've worked together better probably than we ever had. Each organization involved in emergency response has had to stretch their procedures for doing things, but we've come together as a really good team to limit the risk. For one example would be, if we don't need a police officer in a medical call, we just need them waiting outside, we can reduce exposure that way. And every piece of the emergency response team in Rochester has really learned how to work together better, and we've all had to stretch, again, out of our normal procedure, but it's been really positive in the service to the community. I think has been really great.
Has your team had to modify schedules and things like that to support this, given the fluctuation of increases and decreases with COVID-19 cases?
Yeah, so we initially went into an emergency staffing plan. Again, our biggest fear was exposed staff that we had to isolate and couldn't work. Fortunately, we have no documented on-duty transmissions. We've had a few cases around here that have been from people on vacation and whatnot, but so we're out of that plan now, but we have it sitting sort of on the shelf with the fear that this will flare up again. We'll go back into the emergency staffing plan, which gets more people on the street, not at any one given time, and then more time away. So we have that isolation period built in if we have exposures.
Kate, what are your thoughts around what Minnesota has done correctly?
So I think it's a little difficult for me to comment on what Minnesota's done correctly, and it's easier for me to comment on what Rochester specifically has done correctly, because that's the part that I've been a part of, along with Jeff and Mandee. And I think that what Jeff commented on, we've worked really well together as a team. First of all, I think that the city of Rochester, along with Mayo Clinic and the masking mandates that have been put in place. So, for example, this is a really kind of fun opportunity for me because I get to be in my office by myself with the door shut, which means I get to take off my mask.
Yeah.
And that's a rare opportunity for me here at work. But the same thing throughout the city with the masking mandate, although not necessarily our favorite thing, we recognize the importance of it. Like Jeff alluded to with our cooperation and collaboration amongst our teams, very early on in the pandemic, we started meeting with public health, Rochester Police Department, Rochester Fire Department, Olmsted County Sheriff's Office, a number of agencies started meeting together on a weekly basis to talk about our contingency staffing plannings, what were we doing as far as modifying our responses in PPE, what did we need to do differently to support each other. And that did involve maybe an officer responding but waiting outdoors. Whenever possible, Mayo Clinic Ambulance tries to have RFD wait outside if we know that there's a positive screening for a patient, so that we're limiting our access and exposure to them. And just trying to really take care of each other during this time so that those resources continue to be available to the city. It doesn't do us any good if all of the people who responded to that call end up out on an exposure and have to quarantine for 14 days. We want to leave those resources available to the city and keep our city safe and protected as long as possible. So
that is certainly a reassuring.
Yeah.
So I kind of want to touch on the part where, you know, that collaborative effort is protecting each and every one of you. When you go home, is there a process in place to help prevent anything that could come into the house, and how have your families and friends react to you?
Yeah, so I know here at Mayo Clinic Ambulance, we don't have a department policy on it, but many of our people have adapted the policy of we're changing our clothes here at work. Many of us are actually showering here at work. Our clothes go into a pillowcase where we take them home and put them directly into the washer, or we actually allow our team members to wash their uniforms here at work, so that way they don't have to take those home. Especially early in the pandemic when we were still really hesitant about a lot of things, that things as simple as shoes and everything were going inside a cardboard box and staying in the trunk of our car. We were eating meals separately from our families and whatnot. As we've gotten further into the pandemic and become a little bit more comfortable with the process, some of those procedures have eased up a little bit, and we're more comfortable with the idea of COVID-19. The fear has dissipated with it, and we've understood the steps we need to take to mitigate that risk, and still maintain our relationship with our families, which has been really important to our mental health. I think at the beginning of the pandemic, the fear that overtook a lot of us weighed us down as far as our mental health, and made the pandemic really, really difficult.
That's reassuring related to that, Kate, just the game plan, and I think it'll be helpful for the community to hear that. Jeff, what are your thoughts around that? How have you established your own little protocol when you go home and connect with your family or friends?
So early on, we built out a decontamination area out at a city-owned building. We are in somewhat of a unique position in that sometimes we're coming in contact with people that have COVID, and we don't have time to put full PPE on, and everybody's wearing a mask. But so that fear, I would agree, the fear is dissipated. So we do have washer and dryer out there. We have a shower facility. Everybody, make sure they have a second set of uniforms and everything, so we can decon immediately when we have an exposure that we didn't really prepare for because, it just came on a traffic stop or at a domestic situation or something like that. And again, I think we've had great resources from public health and the Mayo team to just sort of calming, and this is how we think it's spreading. These are the things you should do. So I would agree with Kate that a lot of our staff have kind of got into their own routine. People that might have wore a uniform home now take it off. We make sure everybody had, we had a uniform serves that you you only wear a uniform for one day, and then it goes in the wash. So again, I think a lot of that has just worked out as we went along with good information from, Mayo and Public Health.
Thank you, Jeff. What about you, Mandee?
Our situation is a little bit different than the police or ambulance because we're together for 24 hours. We live together, we eat together, we shower at work, we sleep there. Ours is a little bit different, but we try to, after calls, maybe decon, like Jeff was saying, and then a lot of us will take our uniforms off, and then we'll just go home in just plain clothes. That helps a lot. And then around the station, we wear masks when we're not in our rooms, or we'll try to limit the contact we have with each other. In the beginning, we were eating meals in our rooms. We were very, very much separated, which was really tough on a lot of us because we're so used to being together all the time, 24/7 when we're at work. But we've gotten a lot better. We wear masks. We don't work out together as much. We try to limit contact with each other as much as we can. But for the most part, it's just making sure that we're washing our hands, like I said, and wearing masks when we have to.
Yeah, that's an interesting difference, living together at least for 24 hours and trying to figure out, how do you coexist and still protect each other. So what are some tips that you would like to give to the community as you come across people in the community experiencing fear or, emergent situations? Mental health is definitely a concern. Kate, thanks so much for bringing that up. What is, in one sentence, a tip that you can give to the community members? Jeff, you can go ahead and go first.
Yeah, just be cognizant of others and the fear they might have. So that's why I think wearing a mask, regardless of the science, is just a good idea because it comforts people. Maintain distance, don't shake hands. Those types of things are things that I would just continue doing, and through the end of the winter for sure.
It's been a struggle for me because I'm a hugger. So keeping my distance and not tackling people has been really difficult for me to do. Kate, what about you? What in one sentence, what is a bit of advice or a tip that you can give to
I would just encourage people to be kind and be compassionate. Everybody is fighting their own battle in this. And for some people, it's really easy. For other people, it's really difficult. Everybody has good days. Everybody has bad days. And whether you're talking to a first responder or whether you're talking to your neighbor down the street, this might not be an issue for you, but it could be for them. Or you just don't know what other people are going through. So extend a little kindness. In this day and age, you have to support each other. And so if you can be kind and encouraging, we need each other. Yeah.
Excellent advice, Kate. Thank you. Mandee.
I agree with what Kate and Jeff said. And also just, cut some people some slack. Like Kate was saying, not everybody knows what's going on. And we're doing our best we can in the emergency services to try to do anything we can to help you. And if you have questions, we're always here. Just email or send or call, and we can try to offer help. But yeah, just be kind and just understand that we're all going through this.
You all are on the front lines, and certainly many of us in the community have concern for your well-being and safety, and we really appreciate your service. What are some ways that community members can rally around first responders and help?
Like I said, just cut us some slack. We're trying to get there. We may not respond as quickly, but we have a lot more gear to put on. We have a lot more PPE, and we're trying our best. We wear masks in the public to protect you guys from us and what we could be exposed to. So when we go to emergency calls, we'll ask you to put a mask on as well, just to protect everybody that is there in that situation. So we are trying our best, and we're doing the best we can, and we're going to try to give the same level of care we always have. It might just take a little bit longer to get there.
Jeff, can we give food? Is that allowed now?
Yeah, the night shift loves chocolate chip cookies, I can tell you that. But
individually wrapped, probably.
Or store-bought in a pack or something. Homemade they like, but again, we have had outstanding community support. There is always food and treats. Again, individually wrapped is best. We don't want to contribute to the spread, but yeah, the night shift is eating well, as is the day shift. There's some community support.
Hey, what are your thoughts around that?
I would just go back to, again, especially since some of the civil unrest started in May, I would say every facet of first response has experienced some hardship. So an encouraging word, a smile, a thank you really can make our day. It's a hard job right now. between the pandemic and we've experienced a lot of hatred and a lot of toxicity. So if you can say thank you, if you can give us a smile, we're not in this to be heroes. We're not in this to receive praise, but a little bit of kindness and compassion really goes a long way in making our jobs a lot easier.
Well, I appreciate you, Paul, and I know that the community will be incredibly grateful for this spotlight. Thank you all for your service. Please pass on my thanks from KSMQ and the community to your teams. So grateful for what you do in Rochester and beyond. All right, that's it. Thanks for tuning in to our Town Spotlight. This is Danielle Teal, your moderator with KSMQ Public Television. Huge shout out to 125 Live for hosting. We're so grateful for Sylvia. She puts this all together and she's incredible. Annie Krinick is our producer. She goes over and beyond to make this beautiful afterwards and also coordinating, putting together the production. You can catch up with us on Facebook or Twitter at KSMQ #OurTown.